Uroliths, or cystic calculi. Watching for uroliths on abdominal studies. Always check the bladder for uroliths, even if they are here for something else. Anytime uroliths are present in the urinary bladder, an X-ray urinary series should be taken. Cystic calculi can look different patient to patient. Diagnostic findings will look radiopaque or minimally radiopaque, meaning more dense or brighter on an X-ray, to even more radiolucent, meaning blending in or not detectable on a radiograph. A male dog urinary series. A lateral projection will be done to include the diaphragm through the entire rear end with the legs stretched as far back as they will go. A second lateral projection will be performed by pulling the legs forward for full visualization of the urethra previously obscured by the femurs. The radiograph only needs to contain the anatomy that was not visualized in the previous lateral view obscured by the femurs. The last view to be performed in the male dog urinary series is a ventral dorsal projection. This will include the diaphragm through the entire rear end with the legs stretched back out of the abdomen. This case shows why male dogs need to have the additional lateral view with the legs pulled forward. There are urethrolyths visually obstructed by the femurs in the original lateral radiograph. They can be seen on the additional view. Here is the zoomed-in X-ray of the legs pulled forward in that additional view. A female dog urinary series starts with a lateral projection including the diaphragm through the entire rear end with the legs stretched back. The second and last projection for a female dog urinary series will include a ventral dorsal projection. This will include the diaphragm through the entire rear end with the legs stretched back out of the abdomen. A cat urinary exam. This will include one lateral projection that will include the diaphragm through the entire rear end with the legs stretched back. The second and last view of a cat urinary exam includes a ventral dorsal, which will include the diaphragm through the entire rear end with the legs stretched back out of the abdomen. There may be times where an additional view might need to be performed on all these patients. Let's address those now. There may be times that the urinary bladder may be caudal to the small intestines. This creates reduced visualization within the radiograph. In this case, there are uroliths present in the urinary bladder, but visually obstructed by the small intestines. In this case, a compression paddle shot is performed to better visualize the uroliths. Collimating over the bladder, the paddle is pushed down over top the full bladder to expand it and push the small intestines out of the way. Here's another example of uroliths being obstructed by the small intestine. Compression with the paddle on the urinary bladder allows for visualization of the uroliths within that bladder. Look close. They will not always be easy to identify. Sometimes the prostate is enlarged and can push the urinary bladder cranial. Be aware of anatomy when performing these exams. Thanks for watching.